Hi, everyone. Welcome back to a special Neolth live stream event. I'm Dr. Catherine Grill, the CEO and co-founder of Neolth, here with my colleague, Dr. Claire Wheeler, to talk about returning to schools. Thanks, Claire, so much for being here. I was wondering if you could just introduce yourself real quickly to the group. Oh, I don't think we can hear you, Claire.
I do apologize. You would think after a year I would be used to that. Thank you, Catherine. I am Dr. Claire Wheeler, and I am the Chief Medical Officer for Neolth. And I am also an assistant professor at the OHSU PSU School of Public Health here in Portland, Oregon.
So, one of the things we've been thinking about or hearing a lot about is this, return to normal. And I think there's been a lot of excitement with people about the new school year starting and everything's going to be back to normal pre-COVID. But now we have this Delta variant, and that may or may not be true. I was wondering what you think about going back to school this year. Will everything be back to normal, quote unquote, for students, or will there be any difficulties that you think students might encounter this year?
That's a great question, and one that unfortunately doesn't have a simple answer. But as a person who's actively engaged with higher education right now, myself as an assistant professor, we've been having conversations at the School of Public Health all summer about how to reopen in the fall. Fortunately, at our school, we are requiring vaccines for anyone to be on campus, and other safety measures have been put in place that I am optimistic may help us get through the fall term without having to close. However, I can't say the same for school districts across the country in the high school level or even universities across the country. Sadly, there's a patchwork of policies, not all of which are necessarily informed by public health and healthcare imperatives. So I believe that we even looking at a more unsure picture outlook for this year than we did last year, where we had more stringent precautions in place. So while people are, even if your school is planning to open and you're going to plan to be back on campus or back in school this fall, I would be prepared to have disruptions happen along the way, be prepared to be able to shift your learning to online, and just be ready for just about anything, because we're nowhere close to being back to any form of normal that we experienced before the pandemic.
Thanks, Claire, for sharing. And for those of you who don't know, Claire is both a medical doctor and clinical psychologist and has a lot of expertise in this field. I think it really is, it's a tough call. It's just so uncertain. Different areas around the country are facing different challenges when it comes to COVID, and different schools have different policies, like Dr. Wheeler mentioned, around vaccines. And of course, for our K-12 schools, some of the students are too young to be vaccinated. So it really does pose some challenges, but we've been hearing from students that they're really excited to get back to school. The majority of students, I think, want to see their friends, want that social interaction, but we also need to understand too that for some students, going back to school is going to be a challenge after a year or a year and a half of having less structure, and now going back to that structured routine might be difficult. And for students who might be struggling with social anxiety or bullying, it can be hard to go back to that social setting. So I think really for the schools out there who are returning to schools, finding some sort of hybrid is what we've actually been hearing from different schools, is how can they use all of the things they've learned from the past year around remote learning, technology, different interactions for students. How can they use that and continue that for the next school year, whether or not they're remote or in person or some sort of combination? And one of the things, Claire, that we saw last year was this huge demand for mental health resources and just increased need from the students. And we've heard from some people that that might continue, and we've heard from others, well, if we're going back to in person, we're not going to need any mental health support at the schools anymore. Can you comment on that?
Yes, I would like very much to comment on that. In our recently published report, we did share a lot of interesting statistics about what's been going on in the past year. And one of them, one thing that has been documented is a very large increase in demand for mental health support, especially on college campuses, that very much outpaces the rise in enrollments, which means that, we're not just seeing more students, more demand, we're seeing the same amount of students needing more support. At the same time, we haven't seen any big changes in budgetary outlays or policy across the board in how to provide these services to students. And so this is another thing. I think there's a bit of a silver lining to what we've been through and are currently going through, with education moving more online and our work lives moving more online. And in fact, for a lot of people now, they see their doctor online and they see their therapist online. And so there's a growing awareness of the incredible efficiency, accessibility, and utility of digitally and online provided services, everything from healthcare to your groceries to even mental health support. And I think that as schools become more accustomed to providing a fair number of their services digitally, that they will start to understand that you can support students' mental health in the same way, as an adjunct or an add-on to whatever in-person services are provided. But if students can't be on campus, they need something that they can still have access to.
Absolutely. It's hard to hear that people think mental health might just all the problems would go away just because students are returning to in-person learning. When in fact we know it's not just COVID, but the past 5-10 years, mental health, especially for young people, has been increasing. In the report that you mentioned before that we just wrote, it was, I think you said, 5% increase in enrollment at universities over the past 5 years, but 40% increase in demand for mental health services. So this is going even before COVID. So that demand has been increasing, and I don't think that's going to change just because some schools are going back to in person. In fact, I think after this past year, the students are more aware of their mental health, of their stress, of their anxiety, and are really looking to the schools to see what they're going to do as we shift back to this in-person learning, and how the schools can continue to support them in mental health, whether that's through the counseling center, through peer support groups, student clubs, or through digital resources, or hopefully some combination of all of those. So really important to keep mental health top of mind, whether the schools are in person or remote, and to know that things are still going to be tough for the students. They're still dealing with the trauma of the pandemic, and that doesn't just go away because the schools are returning in person, that's lasting. So I think one of the last things we wanted to talk about today in this brief talk was how schools can utilize technology. We saw this massive shift last year where schools are kind of forced into using technology because everything shut down. And now we'll have some schools remote, a lot of schools back in person. Do you think schools will still be using technology, especially around mental health, or is there a place for technology when these students go back to in-person learning?
I would say resoundingly yes, and not only out of my own professional and personal self-interest. I know just anecdotally the students at my university at Portland State have often told me about long wait times to see someone, or they have access to some really nice tools, some biofeedback and other tools for self-regulation that are in the clinic, but there's a long waiting list. They have one biofeedback set up for the entire campus. And so there's already technology being used in it, not only at my university, but a lot of different places in their healthcare centers. They have quiet rooms or meditation spaces, and they have yoga classes, and they have a lot of resources that are available, but they were available before the pandemic, and the need for real support, substantial support for mental health has, as you say, continually gone up. So in-person classes is really not the answer because the crisis existed when that was happening. The good thing is that, as I said before, I do believe schools and people who work there are becoming more accustomed to providing various things digitally. And I also think that some of it can come from students. And you mentioned peer support, and I think that's another thing that really got lost in the year that students had to study from home. And that can happen. Obviously, students take TikTok and Instagram and whatever else they're doing, and they create social networks that are not always to their benefit, but they're there. They have social interactions. So we're talking about a generation that grew up digitally. And, I think to wrap our heads around this fact and to understand that the people that we want to benefit from this are the kids, and they already get it, and they're already using digital resources for all kinds of things. So why not provide something that they help design, that they understand, and that they're already used to using? Again, in addition to whatever else the school is able to provide.
And you said something that really stuck with me. You said biofeedback, which I think is a really cool technology and can help people understand the relationship between their mental health and physical health, because our whole body is connected. But you said one biofeedback machine at your whole school, and you have about 30,000 students. Is that right? Yeah. So I can imagine the wait time. That's incredible. Cool that they're offering that, but we've seen that a lot at schools where the wait time for those types of technologies or for the counseling center is, yeah, it could be months, right? And also, I think what we need to understand is what you said. When the young people are digital natives, it doesn't matter if we're remote and we need the technology or we're in person. I think you still need that technology in person, because that's how you meet them where they are, and that's how you provide them with programs that are engaging and convenient and they're comfortable with. We've heard a lot from young people that there's a lot of stigma and they're scared. One student said it was the scariest experience in their life to go to the counseling center on campus because they felt like other people might see them. And not that the counseling center shouldn't exist. It's absolutely critical that these schools have these brick and mortar counseling centers and therapists. But I think we also need to think about what are those stepping stones to destigmatize mental health on campus, to encourage health education, to encourage help seeking behaviors, and have these students kind of reach out for support and go to the counseling center when they need help. And what we found through this past year in working with about 250 students across the country, so this is at the high school and university level, is really that when we can use the phone or use the computer, use this technology, they can learn about different mental health topics from the privacy of their phone. They can see what other students have experienced through our student stories, that students are kind of sharing their lived experiences. And this really helps them break down stigma. It helps them get access to care on demand 24/7. So if it's the weekend, middle of the night, holiday, doesn't matter, they have that access. And then they'll feel more comfortable with it. And then they'll start to engage more in the things like the counseling center, these biofeedback zones, these meditation or wellness rooms, because they'll feel more comfortable going there. So whether the students are remote and need a completely remote resource for mental health, or they're in person, but they just want something that's meeting them where they are, it's a little bit more private, a little bit more accessible. I think either way, the technology is so important. So went by quickly as always. It was such a pleasure. We're coming to an end of our talk here. Dr. Wheeler, any closing thoughts about mental health and students returning to school this fall?
I guess the last thing I want to say is, as you said, stigma is a powerful thing, but I also have faith in our young people, this generation of high school and college students, because they really are so much more open and willing to be vulnerable than my generation and maybe your generation too. And I feel that when they have the tools that make sense to them, that they're going to get some real benefit from it. And it's really up to us to listen and to respond in ways that are really going to be helpful and not just what we think needs to happen.
Very well said. I think that listening and that collaboration with the students, the young people just want to be heard and they have so much to say. And that's really how we get that engagement in health programs. It's that community participation and their opinions that will help us inform and shape these programs in a way that best suit their needs. So really well said. And thanks so much for being here with us, Dr. Wheeler. That's the end of our talk. We'll have other live stream events throughout the month. And Claire and I will be back next month for another Ask the Experts talk. So thanks everyone for joining.